This is Because Teeth Podcast with Greg Santiago and Cody Preble. So we are back.
Back again with a
Back
new
again.
episode.
New episode. What episode is it?
Episode D.
Episode D. We have a fun-filled topic today, and we will be touching on a lot of different things. I think it's definitely a topic that is
Related to us.
For sure. That's why you took the words right out of my mouth there. But yeah, so we'll dive into it a little bit and really explain, like, I guess our perception on it and how it relates to us personally. And I guess we should just say the topic, right?
Yeah.
Topic what we're going to talk about today is basically just being a guy in becoming a dental hygienist. Mm-hmm. So, obviously, what do we call them?
Guygienist.
That's our nickname.
The going term on it.
So I think this is a really fun topic as well to really talk about, even from, not just a guy's perspective, but an outsider's perspective, to really kind of understand it and go into it a little bit.
Because it is all kind of new to the whole field. So
yeah,
like you said, definitely bringing a whole new perspective to this side of it.
Yeah, but also before we dive into that, I just want to say thank you guys for all listening to our podcast, first and foremost. If this is your first episode, please go listen to our previous episode and also tune into our episode right before this if you haven't already, because we're doing a giveaway. Mm-hmm. So with our good friend Dental Girl Chronicles on Instagram. So make sure you follow her and go on her page to look at the instructions for the giveaway.
Mm-hmm. Yep.
And just make sure, obviously, please also follow us as well. If you're listening to the podcast, follow us on Instagram specifically. We're going to be doing a couple different things that'll kind of make it fun on the Instagram as well. Obviously, the giveaway is something that, to look forward to, but a couple other things that we'll be posting every week and just supporting us in other different ways, I guess. So, thank you guys for, listening to us, but also, engaging with us is really important for us. It helps the algorithm to just kind of keep us, keep posting, so that way you pops up on your page and that kind of stuff. So I just want to say thank you guys for that, and anybody who knows us, thank you for listening to us and supporting us, that kind of thing too, because I'm sure probably have my mom listening and stuff. Yeah. So I just want to say thank you guys for everyone that's just supporting us, in general, but also specifically our family and friends too. So yeah. Other than that, I guess just dive right into our topic today.
Let's go for it.
All right. So, Guygienist.
Yep. And I believe you have a story you want to kick it off with?
Yeah, I'm going to kick it off with this story. So, first day in a dental office. It was a little interesting, to say the least. So, I think it's very relevant to talk about this because it was my first day, and I always tell everybody this story, especially when I was teaching, I used to always tell this story.
And was this your first day as an assistant or just shadowing?
So I was shadowing a dental hygienist.
Okay.
So it was before I got into my externship for dental assisting. I just wanted to shadow a hygienist. Basically, I just went over there to just kind of see a different perspective, because my goal was always even getting in dental assisting, I knew I wanted to go into dental hygiene. Okay. So I had that opportunity to go and shadow a hygienist, and everything was really smooth, and it was kind of an older practice. And why I say an older practice is more just because it was a dentist that had been practicing for a very long time, and has established his patient base, and it's, reoccurring patients have been going there their whole life kind of thing. And I was walking through the office, and I was walking towards the operatory to, the hygienist that I was shadowing, and the assistant was walking the patient out. And the patient stopped and looked at me and was like, "Oh, you have another doctor, working with you or shadowing you." And the dentist was basically, "No, he's not a doctor. He's not he's not a dentist. He's going to dental assisting school." And the patient was like, "A dental assistant? It's a male?" They're like, is he working here? And then I was like, "No, he's just shadowing, kind of watching everything around." And the patient was like, "You're going to have a dental assistant, you've been just shadowing here?" "Yeah, I don't want to come back to this office. I
Really?
feel yeah." And it was just I think it was just an older, kind of mindset of having that, dental assisting, being a female, and seeing a male as a dental assistant. And even though I wasn't even shadowing the dental assistant, I was shadowing the hygienist, but that was just, because I was in dental assisting school and the doctor knew that at the time. So that was, I always like to tell that story because it was just like, patient basically said that she didn't want to come back. And the dentist kind of like looked at me a little bit funny because it was like, this patient has been coming here for so long. And like, now I have you in the office that you're almost like steering patients away. And it had nothing, like there was nothing that happened that would steer it that way. It was just simply because of basically that idea of it, that mindset of, having, I guess, more females in the office than, males, I guess. So it was just a little bit weird. And what if, I always think about this, particularly about that story, because what if that story would have went a different way and that doctor would have said like, yeah, he's going to become a dentist. Like, would it have been okay then?
Yeah, that's an interesting point, because then how would that patient have felt about it?
Exactly. Like how would have that played out at that point? Would it have been okay? Like it would not, she would not have made, I mean, she literally made it a point, like even in front of me, like I was standing there and the dentist was standing there. He's like, yeah, I'm not coming back to this office. You're going to have dental assistants who are males. Literally like almost word for word what I just said.
That's interesting. Especially because the dentist was a male. So yeah, like you said, why would that really make a difference?
Yeah. So I don't know. That obviously that stuck with me. First day on dentistry, feeling super excited, motivated, started learning, all my like dental terms, and I'm just super, all around just like intrigued, and that happened. And just after that, my mood just like changed. It was just like, oh man, like, I don't know, is this for me? Like, do I not belong here? Like it
kind of got in your head more than anything.
Definitely. Yeah. And I also think that this was, obviously many years ago now, I guess, but it was just weird to really like think about that. Like,
yeah, going into it, you probably never thought that would be a factor, or even really kind of considered that would.
I mean, I always knew that was like kind of an undisclosed kind of mindset or thing,
Yeah.
I just didn't really think that, one, it would happen so fast, and also play out the way it did. Like I could just, I can understand like maybe like, I knew something was always going to come from that. Like I knew there was going to be a point where I would have to address that. But I mean, my first day in a dental office, in a dental field, but I will tell you that after, like I said, it kind of changed my mood, and then next day I kind of actually talked with my teacher at the time, and I kind of brought that up, and she was like, honestly, Greg, like we really don't have a lot of like male dental assisting students, and also not like male, like we don't have a lot of them, but we also don't have a lot of them that are so dedicated like you as well. Like you're kind of a little bit different. And, that was just her being personal at the time. I mean, personable at the time, and like really like motivating me. So I really, appreciated that. And I took it as basically like a motivating thing. Like, okay, like I want to break that stigma. Like I want to like actually, now I really want to do this. Like I want to do this even more.
Hey, that I can do this, and that this can be a thing, and it shouldn't be kind of weird or whatever it was.
Yeah, exactly. I used it as motivation,
That's good.
Because it was like, I didn't do anything wrong. Like it would have been different if like, I don't know, like made her feel, I don't know.
Yeah. If there was a situation to make that happen,
which that would never happen.
Correct.
But it was just like it just rubbed me like wrong that day. And I didn't know how to like bounce back after that. And I actually, the dental hygienist that I was shadowing actually didn't like watch this happen at all, because I think she was with a patient or something. I think I was like getting instruments or something like that, or, whatever it was. But she didn't watch it happen. And then a couple of weeks later, I had, I guess the dentist and her had spoke about it. And she's like, hey, I spoke with, the doctor about it. And, we just addressed like, we really don't need patients like that in the office. So if that didn't happen with you, like something else probably would have happened in the future, like with, maybe just not directly with that kind of situation, but with something else. Like if she's that kind of patient, like something else is going to happen. And I don't want to say like that she was wrong in a way, but like that was a pretty, judgmental kind of stereotype kind of thing.
Yeah, especially for no reason at all.
Yeah. So anyway, so I wanted to kick off that episode like saying, because I feel like that was like a perfect story to kind of go off of and kind of talk about all the different things that, I mean, one that we kind of go into, or I guess you want to say like encounter being a male in the dental hygiene field.
Yeah. And I know, before the program started, those kind of were thoughts that were going through my head. Like, how are patients going to feel about me being a guy working on their teeth when typically it is a female that's working on them. I was a little nervous about it. I didn't know how my first patient was going to go, or like you said, how far. I knew I was probably going to cross that bridge at some point, but how early was that going to come? Was it going to be something during school when a patient was going to bring that up, or what? And
it happened to me first day.
yeah.
Like, it's like
on top of everything else. I mean, yeah, you're already so nervous with all of it going in.
Yeah, like I said, I had thought about that, but
Yeah.
I just, not first day. Like, I mean, I guess I, expected something to come out of that at some point, like I said, but just first day, like,
Yeah.
it's just like the like exactly what you don't want to happen kind of thing happened. It was just like, I didn't even know what to say. And I literally was apologetic, and I was just like, I'm sorry, ma'am. I apologize. Like, like I didn't even know what to say. That's literally all I said. And what made it kind of like really like a little bit worse, to be honest with you, is the dentist didn't say anything. Like,
Because he saw the whole interaction
yeah,
happen.
because it was right there. And like
Yeah.
the dentist just kind of like just stood there and was just like, like, what was he going to say? He really didn't know what to say
Yeah.
either, So he was just kind of, like shocked in a way too. Like, and just, it was just weird. It was
Yeah.
just a weird situation. And I just told her, I said, I apologize, ma'am. And I just like kind of kept walking away.
Because
Like,
it is. It's like, it's honestly like, what would you say back to that? I mean,
Exactly.
like you said, you just be respectful about it and say, I'm sorry. And
yeah, like, I mean,
that's all you really can do, honestly.
yeah, it was just weird. But anyways, I mean, those are the kind of things that, you have to think about, I guess, too. Like you said, we do think about those things, like being a male and coming
Yeah.
into this specific role in the dental office. Because like I said, if I had said that I was becoming a dentist or studying to be a dentist, would that conversation or that encounter been completely different? Like, and
Yeah, you never know.
which is so crazy to think about, because I mean, not only could it be, like kind of like a sexist kind of thing, but like, could that have been, also like a different way, like, so I don't know. Anyways, so yeah, I wanted to kick it off with that because that was an interesting kind of encounter that I had to deal with. But I will say that even my first time, assisting and, bringing my own patient back, especially, I know it's so weird to say too, but like once you start working and like you're in a dental practice, like even though you've done it in school so many times, like it's always like the nerve wracking, like first kind of thing. Mm-hmm. And I remember like my first, time, like bringing, like honestly, like a patient back, I was just like you said, like, are they going to react a little bit different? Are they think the doctor's going to bring them back? And that does happen. That I can't tell you how many times that happens as well. Like that some patients even go through the course of treatment sometimes. Like even though they know the doctor is being the doctor and performing all the procedures, they still think I'm a doctor, which is, it's kind of weird to think about, but I mean, I wouldn't say maybe go through the whole treatment like that, but there is certain times where it's like, patients have come to an appointment, like it'll be an assistant appointment, and it'll be something like removing the sutures, and they'll think that I'm the doctor or something, you know, or think I'm another doctor or a partner or something like that, which that happens all the time. And I would say that we also kind of like make it, I wouldn't say that. I mean, I would always like just let the patients know, like, I'm your assistant for the day kind of thing. Like I introduce myself as that, so that way it's kind of established from the jump. Yeah. And that way you don't have to
I think
deal with
that's
that.
a good way to do it. I feel like I've kind of grown to do that with my patients when I first get them. Because at first I don't think I was doing that. And then when we would sit down, they'd kind of be like, oh, are you here for dental school or are you here for a hygiene? Like they wouldn't really know. And then I would have to clarify. So I think starting off the bat saying hey, I'm your hygienist for the day, it kind of lets them know right then. So it's very clear at the beginning.
Yeah. And that's one thing that I had to like really like adjust to, like introducing myself as the assistant, because not that that's a bad thing, but like for me, like I don't know, like I turned it into like more of a customer service kind of aspect. Like I'm going to be your assistant. So if you need anything today, like I kind of like ran by it real quick, like, cause you don't want to like just say, because that also sometimes happens too. Like you'll have patients come in the office and like, let's say they're in pain and like you say you're the assistant or, you're the hygienist, and you say that from the jump, like let's say, and then they come in, they're like, oh, well, I don't want to talk to you. I want to talk to the dentist, so it's like, sometimes like I can help you, like what do you need? Not that I can perform treatment or diagnose you or anything like that, but at the same time, like I might be able to like recommend or say certain things that might help you, and so you get, it's kind of like a fine line.
Yeah.
Like it's like, you're walking like a little bit, like you kind of have to feel it out a little bit, because from my experience specifically, I would always say like, or I would always go through like maybe the first couple of minutes or like start doing stuff and then kind of feel out the patient to let them know, like if I need to let them know, like, or, like kind of thing, like kind of guide it. So I don't know. I think it just depends.
Yeah, because I guess in all situations you might not have to even address it. With some, it might not come up as much.
Yeah, like I mean, not that we're judging people from the jump, but like you can kind of get that like aura of somebody who you feel like can that you need to like let them know, like kind of thing. One thing I learned too is patients from different ethnicities always assume you're the doctor. Like, because, maybe in their country or, back in, where they're from, that is like still like non-existent. Like if you're a male, like you're a doctor.
Okay.
And, we might be kind of like breaking that cycle a little bit here, but back where they're from or in their countries or other countries, that is not a thing at all.
It might still be a little bit behind the curve and not really as progressive, I guess.
For sure. But like I said, I kind of use it as motivation, and I know that was like one thing that I always like to kind of, I guess, use in my favor as well. And I think that we should definitely like, talk about the positive from it. I know we're starting off a little bit with like saying these kind of like bad things, but there's a lot of good things that come from, being a male and becoming a hygienist, even though it's a female dominated industry and career path, which, it's crazy is I actually looked up the percentage before the episode. You want to take a guess? I
think it's around like, I want to say before I said 4%, but I want to say is it around 6 or still it's 4%?
Yeah.
And 4. I did see a statistic. I think in like 1999, it was at 1%.
Wow.
And now it's
20 years later.
Yeah.
Only 3 more percent. Which, I mean,
in the overall scheme of things, when you think about the actual number of hygienists that would mean, it's a little bit more than when you think of it as a percentage. Yeah, but it's still low overall. But it is growing.
We're pushing for it, and I think that's a good thing that coming on here and doing all of this. Not that is the goal with this at all, but at the same time, like let's make that known. Like,
it puts it out there.
Yeah, and one thing that I always like to say, like, becoming being a male in the field as not being a dentist, whether it's a dental assistant, whether it's a dental hygienist, but really just kind of breaking that stigma, but also letting people know that you can do it. If you don't think you can, you probably can, and it's like one of those things that it's not saturated, and there might be even some dentists that looking for male dental hygienists, because whatever. I don't know why, but I that's actually a good conversation. I would like to have that.
Yeah.
But like if dentists like look for that, or do they steer away from that? Because there might be some dental, practices that maybe they steer away from that for certain reasons. I don't think it's a discriminating thing at all. I just think that there just might be a little bit more,
because it might raise some of those questions. It potentially could that we just discussed, and they might not want that or might not be ready for that. I don't know if that's the correct word to use, but
yeah, you're right.
Just kind of bringing that into the office, because I guess when you do bring on a male hygienist, you might have to be ready or just kind of expect that, hey, a patient might potentially have a question about this, and it might be something that gets addressed.
Yeah. And one thing too is like, patients that have been there for so long, and now it's like this, and not that it's a bad thing, but it's an adjustment.
It's a change.
That's how I would put it, is it's an adjustment all the way around the board for the patients, for the doctor, for the practice, and, of course I'm going to be an advocate and say like, it's good. Yeah. It's going to be a good thing. Like, and there's a lot more, not that knocking it, because one, obviously, females are successful in this field for a reason. It's because they're good at it. They're really good at it, and definitely I'm comfortable saying that they're obviously a lot better than us, as far as like being a male, because they have that nurturing aspect, that motherly instinct that we can't really offer. but we can do it in different ways.
Correct.
You know, like we don't do it in maybe not that sense, but we do it in a little bit of a different way.
And I feel like it also helps us kind of have that a little bit more of a drive, you know, to like, so we don't necessarily have that, but it helps motivate us to, hey, you know what? I want to try and be the best version of ourselves that we can be.
Yeah, no, agreed. And a big point about that, like talking about the nurturing thing is, you know, part of our school's program is that we had to go into a, you know, a child-based basically practice. And, you know, I had like a little bit of an odd kind of like, even all my years assisting, like I didn't have to deal with many, you know, children being in a perio practice, but at the same time, like going into that, I kind of had this weird, I guess you can say like fence up about kids in a way. But going into that office, I mean, obviously not that we were like forced, but you know, we have to go there in our program. And I was a little bit hesitant, and dude, I actually loved it.
Yeah.
Like I loved working with the kids. Like it was like so much fun. Like I had this weird thing, like, I don't know, like, you know, I didn't really know what I would connect with the kids because like I said, you know, like a lot of, you know, females have that whole, you know, mothering, nurturing aspect that, you know, you don't have to be a mother, but they have that instinct, you know? And I was just like, I don't know what I'm going to talk to them about. I don't know. But you just find stuff. And dude, kids are so entertaining. They're so much more, you know, like engaged, like, oh, what is this? What is this? And, you know, sometimes it's a, you know, we're not going to explain like, oh, this is the, you know, fluoride, you know, varnish, you know, like we explained
kind of break it down a little
terms.
simpler terms. Yes.
Yeah. You know, but at the same time, it was fun. Like it kept it entertaining and it kept the appointment going, you know, pretty, I guess fast, you know? So I really like that.
Yeah. I kind of had the same mindset going into it. I wasn't really sure like, oh, what am I going to talk to these kids about?
Right.
It's kind of all running through your head. And then when you get there, it's really not like you're picturing it, and you kind of overthink it honestly before.
Definitely.
And then it's a lot more simple when you're actually in the situation. And
I think that is a perfect way to lead into this whole thing about like, you know, being a male and coming in dental hygiene. Like, don't overthink it.
Yeah.
Do it. Like, first of all, like we need more, like, you know, and also too, like it's fun. You can do it. Like, it's not as, you know, don't overthink it. It's not, it's not all like, I don't know I'm not sure how I want to say it, but it's just definitely just don't overthink it. I guess it's just how I want to leave it.
I think we both can agree. We've had a lot of support from people in our program, other students, even the professors and stuff, just a lot of support being guys in the program.
Yeah.
And any people who guest speakers that have come in to talk to us,
yeah,
they love to see it.
Yeah, exactly. That's a good point. You say that it is like we want to embrace it. We, you know, and others want to embrace it. And like you said, all of those speakers for the most part were female that said that. Like they like to see it too because it's a good balance. It kind of just keeps things, you know, like I think it's just like breaking the stigma is what I want to, you know, kind of keep it at because we can do that. Like we can be the change, you know? And that's why I like that. First of all, like me and you have like such a balance, like in our podcast, because, you know, I have a little bit of experience, like going into dentistry and going into the program. You really don't have any specific dental thing, but it balances, you know, like that's part of it, you know, like we have a balance, like, you know, it's fun to see your perspective, even though like I've also been in your shoes, like as far as like, you know, starting things and having those like
fresh. Yeah.
Yeah. You know, like everything you've gone through, like I've just gone through it years ago, you know, but at the same time, like it's cool to see, you know, another male in the program. And I think it's definitely like helped us because we've been able to like bond over it.
Yeah.
And that's like the first thing that, I mean, I think we said that story in another episode, but you know, the first day I was like, yo, Cody, we're going to be friends, dude.
Yeah.
Like,
you knew it from the beginning.
We just had to, like, it was just because like you said, there's just not many and we want to really like, you know, push that and make it as just get as many guys as we can, you know, kind of helps us because we can talk about sports, you know, and that kind of thing. And, you know, and that brings me to the next point about like talking with patients and stuff. Like, you know, we touched on it, you know, a little briefly, but, you know, like engaging with patients with certain topics, like versus like, you know, having that male perspective versus the female perspective, like we can talk about sports. So we make our males feel a little bit more comfortable, you know? So, you know, I think there's definitely pros and cons.
to the whole thing. That's for sure.
For sure, you know, and
With anything there is.
there is, exactly. But I think that we can make it more, you know, pros versus cons.
Definitely.
And you know, just keep it that way and keep it going and keep it increasing and get more and more and just keep it on the incline.
Yeah, and then at some point that'll be the normal. Just like I think I mentioned the nursing thing before. You know, hopefully one day it will be normal, just like with nursing.
Yeah,
To see a male and a female. And
I will say that I feel like, I mean, not that I'm in a hospital a lot, but I have been in the hospital because, you know, like my mom. But seeing a lot more male nurses, like a lot, dude, like a lot.
Yeah.
Which I feel like now it's definitely like that's not a thing anymore. Like that's not a thing. Like it's still a little bit of a thing with dental practices, a little bit as far as like the dental hygiene side and assistants. But I mean, this conversation could go a whole nother way too. Like talk about like females being dentists. Like
correct, yeah.
You know, I mean,
And I mean that itself is grown and has grown. I'm sure if we looked at the statistics,
yeah,
they probably show about the same.
Yeah,
How it's grown.
definitely, and that is I feel like that's a really good thing too because. I mean, I feel like it all goes hand in hand. You know?
Everything that we're saying, they're probably advocating for the same thing.
So, anyways, the other thing that I wanted to talk about was obviously, you know, we talked about going in, like having that mindset of like talking with patients, having that nervousness, but also having that kind of go into a little bit of what was your first thought, like getting into dental hygiene, like take it all the way back, like what did you debate that made you want to like get into dental hygiene, like being like a male, like what was your mindset of like saying like, no, I can do this, like what made you say that? Like I kind of told you my story a little bit, like how I kind of got into it, like I always wanted, you know, to go into dental hygiene, but what really pushed you to say like, no, like that's not going to be a thing, I'll do it? Because, I mean, did you know any dental hygienists before you got into this program that were males?
No, I didn't know any, I hadn't even seen any in any offices, never had any work on me that were a male.
Exactly. So what made you, like, say, no, like, that's not a thing? Like,
I think I always, like I said, I keep going back to the nursing, but that's kind of what I compared it to.
Okay. And
I know, like, we're just ahead of that curve, like, of men kind of joining the field. And I knew... I didn't think it was really going to matter. Okay. I didn't really let it bother me. Like, I didn't know that there were going to be other guys in the program. I applied to the program. Honestly, in my head, I was like, I'm probably going to be the only guy in it.
Yeah.
And I'm glad that, I mean, I'm not to say that I'm glad that I'm not the only guy, but like you said, it definitely helps and kind of gives just another person to kind of bond with and all that. But I was just prepared to go in being the only guy. Yeah.
Well, that's what I was going to say. I'm used to that. And, you know, I actually had this conversation come up recently. You know, I'm used to like being, you know, let's say outnumbered in a way, like being around, you know, so many assistants that are all female. And I'm always the one guy assistant. And, you know, even like when I was teaching dental assisting, like when I would have a male assistant come through, I was like trying to like be their best friend. Like, you know, I was like trying to like really, really push them, do anything I can to help them. Because I will say that there is a bit of a struggle from, because, you know, like at first, like that mental, like breaking that barrier, you know, like just kind of, I don't know, like just breaking that wall down where it's not uncomfortable anymore, you know, like, because I mean, even I will say that there's some times where it's like, you know, I'm just like kind of quiet, I guess, a little bit, because it's like, oh, you know, I mean, like, I'll give a stupid example. Like, even when we're in clinic, you know, like, it's like, you know, how we joke about, they're like, oh, like, girls, come on. And it's like, oh, what about us? You know, like, you know, and I just like, hey, like, you know, and I always say stuff, you know, and I joke with the instructors about that. Like, because it's like one of those things, they're used to not having guys there, you know? So it's like, I really kind of like to advocate for that and obviously like really like try to help anybody. So if anybody has any questions, like obviously reach out to us.
Yes.
We'll definitely answer any questions. If you want to come on the podcast, let's do it. You know, if you are, you know, a male hygienist, you know, we would love to like do another like kind of like round table, kind of talk about this subject a little bit more, maybe with somebody who's actually practicing, you know, because I mean, honestly, not for nothing, even, you know, with the practices that I've worked at, never had a male hygienist, and I want to say there was maybe one male assistant that I came across with practicing. You know, students different, but, you know, male hygienists, I haven't come across one. So I would love to interact with one and kind of speak with them and ask them some questions, because even though I've been an assistant and been in, you know, dental office, like I still have questions as a dental.
Yeah,
you know.
and kind of get their outlook on how it has all been.
Definitely.
And I'm sure they've seen quite a few changes as well.
Yeah.
And where they kind of see it going also.
Yeah. So, but anything you want to add to that part of, I guess, this episode?
No, I think that about covers everything for this episode.
All right, so we'll wrap it up here. We got to get into our segment.
Segment of the day, dental terms. Dental terms 102. All right, so today's dental term is brought to you by Greg.
So my word is actually pretty interesting. I couldn't really find a word that had anything to do with our episode today. So
Okay, yeah, we had another one that made it a little interesting to tie a word back to.
Yeah.
But that's okay. We know we always won't be able to do it every single time.
Yeah. So, but anyways, this is still a really good, I feel like, word that we should know that I don't actually even remember this word being brought up in any of our classes so far.
Okay.
You know, not that maybe it hasn't brought up yet, but I feel like this would have been brought up in one of our classes we already took. I'm not going to tell you because it might give away the definition a little bit. But the word of the day is going to be pyrophosphates. And then basically, pyrophosphate toothpaste. So that's a kind of toothpaste. Pyrophosphate toothpaste. And normally, like one of our episodes, I tell you break down the word. You can't break down this word.
Yeah,
too
no, I was
much
trying to think about
because
it
because the word doesn't correlate too much with the definition. I mean, it
know
does,
where you
but
picked that word from. But all right, yeah, I don't know
right?
that one.
All right, so the whole idea of pyrophosphate toothpaste is that it's basically like an anti-calculus agent. Like it blocks the formation of calculus.
Okay.
So the actual definition is it's chelating agent with low toxicity and a broad range of applications such as food additives and industrial applications, but it inhibits calcium phosphate deposits in the form of dental calculus. So pyrophosphates, how we're going to basically remember it is it inhibits calcium phosphate deposits forming, basically, because that's what calculus is.
Okay.
So that's what it basically blocks that. So I thought that was an interesting.
What was the name again? Pyrophosphate?
Pyrophosphate.
Okay. All right. I can see that correlation with it too. That
word of the day. That was
so if it pops up. Now we know. That
was dental terms. So dental terms 102.
That was a tricky one today.
I like that one though. I thought it was a pretty good one.
That was pretty good.
So yeah, we'll wrap up this episode. You know, want to thank you guys again for listening to our podcast. Hopefully you like the topic today, and we might have a couple more episodes on this topic specifically. And that's really much it. Only other thing I want to say is obviously just give us any feedback you have at this point. We've already done a couple episodes, so we'd appreciate a couple, pointers or comments. Anything you guys have for us. If you have any questions, you can email us at because.teeth@gmail.com. Like us on Instagram. Follow us.
Put it in any comments either.
Yeah, put on any comments. I believe we'll have the comment feature on the podcast. If I'm not mistaken, don't quote me on that. But if I'm not mistaken, you might be able to, at the very least, probably send us some type of message.
That's true, yeah. They can always message us.
And definitely follow us on YouTube. You know, like and subscribe this video if you liked it, if you like this topic. If you're any guy hygienists out there that you have any questions, feel free to reach out to us. You can email us directly. You can message us on Instagram. Any questions, any pointers maybe that we didn't cover that you guys would like us to talk about. And that's pretty much sums up this
episode. Like we said, just make sure to check out the last one over with Dental Girl Chronicles. as far as what's going on her page. So
yeah, so that way you can tune into the giveaway. So we'll pick a date to, we already picked the date to do the giveaway, but just make sure you follow all the instructions on her page. So if you have, questions, you can ask us, but go on her page. They'll have all the instructions. So other than that, thank you guys. And we'll tune in next episode. Next episode, we'll have a pretty good topic to cover as well. It might be a little bit tie-in off of this topic as well. And that's about it.
Yep. See you for episode E. Why do we do it?
Because teeth.